Hey helpers, you asked what to do when a client presents with complaints of both anxiety and depression. I love this question. This is a great question because we see it all the time in therapy. People do not present with oftentimes singular complaints, right? That's why we have a primary complaint, because there's secondary and third and fourth and fifth, and life is messy, right? Life gets very messy, and mental health is not siloed, right? There's a lot going on within us in our biology and life and context and circumstance and person and environment, right? We learn that all the time. So there's a lot of things that are contributing to our quality of life, our mental health, and people will not usually present to therapy complain of one particular thing. They may have a particular barrier they bring up, their pain point, but as far as their symptomology, oftentimes there are different complaints going on. So in graduate school, if you're new to therapy and you're fresh out of the oven, sometimes in graduate school they will focus on how to diagnose specific things or treat certain conditions, and you might have particular classes around those, unless it's like a differential diagnosis class or something like that. But oftentimes what we see in practice are co-occurring disorders, and sometimes there is a very prominent issue like major depressive disorder or social anxiety, or maybe it's a form of psychosis like schizophrenia or schizoaffective disorder, and it's a little more direct that way. But oftentimes I would say the majority of the clients that I've seen come across my desk definitely have a myriad of complaints. And so we're just going to touch on that for a second and kind of in practice, how do we handle that? Like, where do we start, right? So we're going to talk about the interplay of anxiety and depression and what that looks like, okay, in effective therapy. So just understanding, of course, it's very normal to have co-occurring disorders, and but understanding the interplay among these disorders is important because oftentimes they share a lot of the same symptomology, and trying to tease out where that's coming from, as well as how it's interfering with the quality of life and activities of daily living when we're working with clients. So just to kind of recap, anxiety is usually comprised of things like excessive worry, fear, and unease about the future. I usually think of anxiety as future tripping, right? Especially in terms of how we relate to the world around us, fear of not measuring up or not being on par with our peers in terms of life accomplishments and checking the boxes and that kind of thing. See that it's a lot, especially since the pandemic. You see this a lot with young adults and getting a good start off in life, especially if you live in the LA area like me, and the cost of living is outrageous and income hasn't really caught up with inflation and all of that. Sometimes it's a lot harder to get a start than maybe it was, some years ago. And so there's a lot of anxiety with that too, about independence and making a way for oneself, right? A lot of, relationships, a lot of things. Depression is often more persistent feelings of sadness, hopelessness, and loss of interest in things, known as anhedonia. But depression is often, I think of that more of rumination about the past, shoulda, coulda, wouldas. Again, feeling like life isn't going the way you want it to go, but it's a lot more focused on the past, whereas anxiety is a lot more focused on the future, and robs us of the ability to be present. So that's kind of sometimes how I think about the two, kind of on a surface level. But understanding that both conditions can significantly impact our quality of life. And I'm wondering what your experience has been as a therapist. How have you seen these conditions overlap, and how do you typically address that out the gate when a client's first presenting these complaints to you? Like, where do you start? How do you handle that? How do you tease those things out? How do you frame it with a client? Just curious about your process. So feel free to share in the comments about that. So as we mentioned, the comorbidity with anxiety and depression, definitely you see a lot of these overlapping symptoms like excessive worrying, difficulty sleeping, insomnia, difficulty focusing, difficulty concentrating or making decisions, just sometimes referred to as decision fatigue, or sometimes clients will complain of feeling easily overwhelmed, right? It's because that processing power is not there, that RAM executive functioning, right? Restlessness, frustration, highly irritable, physical aches and pains, those somatic symptoms. So while we can assess individually for each disorder, when we're doing our intake assessment, we really want to kind of understand that there is a lot of interplay. And just because as clinicians, we might ask the questions in a silo, that the way the client is experiencing the symptoms, they're not thinking about them as silos. They're just thinking about, hey, this is what I'm going through, and it's really messing me up. It's really interfering with my goals in life, and I need help, right? So from a clinical perspective, yes, we want to try and understand what camp they fall in terms of symptoms, so we have a clear idea, compass of kind of how we're going to label the challenges. But keep in mind too that as we're treating these conditions, that it's not so siloed, it's not so textbook, that this is just a compass to give us an idea. But don't get too hung up on, is this anxiety or depression, and which one do I treat? Because a lot of times we end up treating both. One is definitely tends to be the primary issue, and the other one's more secondary. Sometimes you'll see them toe to toe, but usually one is kind of aggravating the other, or one is more of an impairment than the other. Somebody can have more anxiety than they do depression, but as you do your assessment, you'll probably find that maybe the depression is causing more of the impairment. They've learned how to cope with the anxiety, and that might not be why they're struggling so much, you see. And so that's why it's important to understand not just which one is heavier, but which one's causing more of an impairment, okay? Some risk factors, of course, when we're talking about any mental health condition, but especially with anxiety and depression, we're looking at genetic predisposition. It is pretty well accepted that there's a genetic factor, and I think there's still a lot of work to be done there in terms of the science, but there does tend to run in the family, in the genes. Environmental stressors for sure, like trauma, chronic stress, work, home life. Those are all the things we want to assess for, person and environment, and that biopsychosocial, right? Neurobiological factors. This is where we talk about the neurotransmitters. When I was saying, like, yeah, both often related to serotonin issues, and you may want to look more into this, but I do recall a study being done on how anxiety and depression is oftentimes assumed to be caused by a lack of serotonin in the limbic system, or the back part of the brain, whereas psychosis is oftentimes caused by too much serotonin activity in the front part of your brain, which makes treating things like bipolar disorder a little more tricky, right, with medication, because they're trying to target and balance the serotonin in both parts of the brain. Kind of how I think about it. I could be wrong. Correct me if I'm wrong, please. But that's kind of how I think about that. The neurotransmitters, right? You have your dopamine, your serotonin, your noradrenaline, but serotonin tends to be the usual suspect when it comes to anxiety and depression. And I try and remind clients that serotonin is not, they can't bottle it. Antidepressants, anxiety medication is not bottled serotonin. SSRIs are only helping your body recycle your serotonin. So sometimes I refer to it as kind of like brewing coffee through the same grounds twice, that it's not going to have the same oomph, but it's better than nothing. Because oftentimes what happens is your receptors, when they pick up the serotonin, they discard it, they pick up another one, but if you run low, then your receptors get underwhelmed, and that can sometimes reduce your distress tolerance, your anxiety comes up, it's harder to regulate your mood. So those medications sometimes help you recycle that serotonin to make up for what's not there, what's missing. But serotonin is only made by your body, so that's a whole other conversation, right? But a big part of that is your tryptophan. So that's one of your essential amino acids and proteins, and some foods are higher in tryptophan than others. Eggs, nuts, fish, you can Google it. But definitely tryptophan plays a part, as does sleep, because you make that deep sleep where you make that human growth hormone. That's definitely part of the precursors, as is niacin, which is like your leafy greens and vegetables. And exercise helps you secrete more serotonin, but you also need the building blocks. So that's an important conversation to have with your clients. And I definitely, encourage clients to talk to their primary doctor and a nutritionist if they're having a hard time managing a good diet full of their micro macronutrients, we can't really separate the physical and mental health. But again, that's a whole other conversation we could talk about. But serotonin is, definitely a key player here. Cognitive biases and negative thought patterns, definitely you see that in both camps, and it's definitely a risk factor, as we understand like things can be psychosomatic or psychosomatically agitating. We might have an organic condition or predisposition to anxiety or depression, but how we manage those conditions, right, oftentimes can make them better or worse. So that's why people oftentimes seek therapy, because with cognitive behavioral therapy and similar approaches, we can learn to reframe a lot of the challenges we're having so as to not cause more distress. And we can get in the whole talk about dendrites and what fires together, and that whole thing. But thoughts are important, and thoughts are powerful, and thoughts can definitely make recovery, faster or slower, depending on how we approach it. So that's definitely the power of talk therapy, is addressing those cognitive biases, core beliefs, our thoughts about ourselves and the world and how we view it and how they all play along. So, what other risk factors have you observed in your practice other than genetic predispositions, environmental stressors, and neurobiology? I'm very curious kind of what you've seen as some kind of suspects to make things worse or put somebody to more of a disposition to these conditions. As a therapist, you're probably familiar with the cycle of anxiety. This is just my little something I threw together diagram that kind of helps me think about it. But basically that same kind of ABC cycle: your antecedent, your behavior, your consequence, and of course those intermediates of your thoughts and your feelings. And CBT, of course, we focus on thoughts because thoughts oftentimes elicit feelings, feelings elicit coping behavior. But for clients who are experiencing anxiety and depression, you will see oftentimes this cycle as you're talking about what's their triggers, how they're coping with their triggers, what does that mean to them, and it kind of follows this usual pattern. And our job is to help clients figure out, okay, not so much is this anxiety or depression, but when you're triggered, what's triggering you? And when you're triggered, how are we coping? So we're trying to get ahead of things by helping them label their thoughts around the triggers, be that from a place of anxiety or depression, right? And the anxiety and depression is important to understand in terms of how they're coping. It's also going to help us kind of identify what their triggers are and do that work there. But really it's this cycle and figuring out the points of intervention for future implications so we can help them interrupt this pattern, right? But it's oftentimes self-perpetuating. Not to say that if you break the pattern, your anxiety is going to completely go away, or depression, but it certainly helps in terms of coping and recovery. So diagnostic challenges, of course, when we're trying to do a differential diagnosis or you're doing your intake assessment, trying to figure out which symptoms overlap and complicate an accurate diagnosis. So you can kind of look through the DSM diagnoses there. Something that really helps me is outcome measures. And if you're looking at outcome measures, the ones I usually kind of start off with, and you probably do too, are the PHQ-9, which is the patient health questionnaire. Oftentimes clients will have gotten this beforehand in their primary doctor's office, and their primary doctor will have referred them to you or me because they scored high in the PHQ-9. This kind of summarizes the depressive symptoms. Typically, if they score over 18, it's more severe. If it's over 14, it's considered depression. But you can look at the website for that and kind of figure out how it's all calculated. But it's a really good to get a baseline, but also gives you an idea of which one is kind of trumping the other. And again, even if you look at the PHQ-9 on the GAD-7 here below, the GAD-7 is the general anxiety disorder scale. And that's going to give you some of those salient symptoms around anxiety and help you not just guide your treatment in terms of which symptoms you want to watch out for, or which symptoms you want to target that are causing the client the most distress based on the self-report, but also kind of compare apples to apples. And sometimes what I'll do, well, almost always what I do is once I'll calculate them, and let's say it's 17 out of 27 because PHQ-9 is out of 27 points, the PHQ-9 is, yeah, 27 points. The GAD-7 is out of 21 points. And I'll just divide that and get the percentage. And whichever has the higher percent will kind of cue me in to say, oh, okay, so this is probably causing them more distress than the other. But again, it's just another tool. It's not an absolute definitive thing. It's just to help keep us honest as therapists, to make sure that we are paying attention and we're not just making assumptions, right? So there's that. And then there's also the OQ 45.2, which is one of my favorite outcome questionnaires, because it's not measuring or looking at a specific issue like anxiety or depression. What it's actually doing is looking at the... Well, sorry about that interruption. That was weird. My camera just decided to quit all of a sudden. So I think it's the software. Why I can afford it, I'm definitely getting a better DSLR camera. Anyway, sorry about that. As I was saying, the outcome questionnaire is one of my favorite tools because it's not like it's measuring just depression or just anxiety or looking at a specific condition. One of the reasons I love the outcome questionnaire, the OQ 45.2, is because it's more of a global questionnaire that's looking at the quality of life and the client's overall satisfaction, and then it breaks it down into particular sections. So I think that is of particular interest, and so it goes through very specific areas of life. And I always tell a client when they're completing the OQ 45.2, if it doesn't apply, just check 0 or leave it blank, because some would not necessarily apply, like if you're not married or you're not in relationships or whatever. But very cool tool. So between this and the GAD-7 and PHQ-9, gives a nice baseline to kind of start off with, and that's going to help you really discern what's going on, as opposed to worrying too much about, is this anxiety, is depression? Yes, a diagnosis is important. And I know if you're working with insurance, you have to really have a diagnosis out the gate, which can sometimes be frustrating. But I would encourage you, try not to get too tied up or worried about, which one do I focus on, because it's really about understanding the client and what's getting in the way of what they want. And sometimes it's figuring out what do they want from life, right? Because that's sometimes the hardest part of therapy for a client. That's why they're presenting oftentimes, because they don't know, they're just so stuck. And so just understand that anxiety and depression, they co-occur all the time. And these questionnaires can kind of help you tease out, okay, maybe it is anxiety and depression, which is fine. That happens all the time. And then it's your job to figure out what kind of anxiety. Is it general anxiety? Is it adjustment disorder with anxiety? Is it a specific anxiety? Is it social anxiety? Is it agoraphobia? Is it panic disorder? So same thing with the depression, right? And so maybe it's adjustment disorder with mixed mood anxiety and depression. Maybe it's major depressive disorder and general anxiety disorder. You'll figure that out with time. The most important thing is to not let it trip you up too much. Just understand that it's very normal for both of these conditions to overlap, especially to co-occur, especially because oftentimes they're both caused by the same thing, a lack of serotonin. So when you're treating anxiety and depression, just understand that oftentimes it's going to require integrated approaches for treatment. For example, if you're looking at anxiety, you might be doing habituation hierarchy, or AKA exposure therapy. If you're focusing more on the depression, you might be focusing more on the behavioral activation side of things. So for each diagnosis, if you were, you're going to have your own treatment goals. But don't let that trip you up too much. A lot of therapy is kind of shifting between goals and not just focusing on one for the whole course of treatment. So that's just anyway, it's been my experience. Just understand, if somebody's complaining of both anxiety and depression, they're probably going to have a longer bout or treatment of therapy if you're trying to hit both goals and you don't want to button things up before you see progress in both areas. It's just going to take a little bit longer if you're toggling, or maybe you have that conversation with the client on the front end. Say, hey, this is what I'm seeing. I'm seeing that you have these problems around anxiety over here. You have these problems over here with depression. Would you like to focus on just one? So you see quicker outcomes, or are you okay with kind of addressing it all as we go? And then it just might might seem like it's taken longer to feel better, but that's okay. That's normal, and just normalizing the process with them and giving them some autonomy and how you want to go about that. Evidence-based approaches. I'm a CBT guy. That's what I'm, certified in by the Academy of Cognitive Therapy. I love CBT. I love solution-focused therapy. Other methods could be ACT therapy, mindfulness, cognitive therapy. So I'm curious, what are your favorite approaches when you're dealing with anxiety and depression? What are your go-to modalities? Share with the group. I'd appreciate that if you want to leave that in the comments and kind of, support the community with your experience and what you've found to be effective and useful. That'd be great. So keep in mind, nothing's written in stone. In therapy, it's not like, especially if you're new, you're gonna feel like you have to have it all kind of figured out the gate. And if you're feeling lost or struggling, somehow you're doing something wrong. That's not the case with therapy. It's very much a kind of play as you go, and you figure it out, and you try different interventions on and see how it fits. If you feel like you hit a wall, that's okay. You just go back to the drawing board. But therapy is very much of a collaborative experience with the client, and just keeping in mind that it's an art as much as it is a science. In every case, every person you work with is going to be a very different experience. It's a very different relationship with every client. And so just trust the process, right? You have the tools you need. You'll get there, and the pieces will come together as you move along. Okay. Just remember, as you do with clients, that self-care is paramount, and as it is for you to take care of your clients, you have to be taking care of yourself and manage. Think about how you manage your stress with self-care. How do you manage your anxiety? Same thing is true for our clients. We just have to reinforce that, primarily, it's about consistency with the self-care and managing what we can control versus what we can't. That's always a good starting place, whether we're dealing with anxiety or depression. Okay. Of course, you can use those same outcome measures, the PHQ-9, the GAD-7, the OQ45.2. You can use those to kind of monitor progress as you go. Just use those outcome measures periodically, and that's going to help you kind of track how they're doing over time. Okay. So takeaways, conclusion: anxiety and depression are both often co-occurring and have overlapping symptoms. Using a comprehensive assessment during your intake will really help you create accurate goals, right, and diagnoses around what you're trying to treat. A lot of that will be teased out during the assessment as well as with the outcome measures. So there you go. You can also use the outcome measures to monitor your progress as you go. That's always best practice. It helps you kind of know where you're at and if things are improving or not improving, or if other issues are creeping up that weren't there before. It just kind of helps you kind of reassess, right? Because, life happens as we're doing treatment. It's not like life is paused for the client when they enter treatment and nothing else changes, right? We want to continue to assess for those other areas of life that might be in flux. So super important. So what were your main takeaways from this presentation? I'm curious. And what feedback would you give to the community of therapists here about what could be helpful? Is there something I didn't mention that you feel like would be really helpful for another therapist who's maybe not as comfortable working in the field yet, maybe fresh out of college or something, and somebody complains of having anxiety and depression and maybe some psychosis, and they're feeling a little overwhelmed about where to start? That's perfectly normal as a new therapist. But if you have any words of wisdom, please, feel free to jump in. All right, because we're all in this together. So I hope that was helpful. Those are just some thoughts. I know, a little bit long-winded, I'm sure. Sorry about that. But that was a question that was posed, and it's something I see all the time. So I just thought it'd be helpful to make a video about. Hey, if there's any videos that you would like me to make, any questions you would like me to take a poke at, feel free to use the contact form in the comments below and in the description if you have anything you would like to be presented on the podcast, or if you want to come on and be a guest on the podcast, let me know. If you want me to just take a poke at a question, feel free to punch it in there, and I'll get to it as quick as I can. Well, I hope that helps. I am your guide to the art and business of therapy. My name is Patrick Martin, and I hope you have a great rest of your day. Keep thriving. Bye-bye. Hey, if you're getting value from this content and you haven't done so already, be sure to like and subscribe to the YouTube channel and podcast, and be sure to subscribe to the MHT newsletter. That way you don't miss out on any new content as it's released. Links in the description.